all the tough decisions you have to make today, your family's health doesn't have to be one of them. Not when you have the choice to go organic and live full, natural, and holistic lives. So start your day right. Load up on antioxidants. Choose only organic superfoods. And keep the momentum going. We're making it easy for you. Live organic, choose organic. It's easier than you think. Mahalagang paalala, ang Organic Acai Premium Blended Freeze-Dried Capsule ay hindi gamot at hindi dapat gamitin panggamot sa anumang uri ng sakit.
Organic acai has very high levels of antioxidants and essential nutrients that help keep your immune system strong. Organic acai Premium Blend and Freeze-Dried Capsules daily to help increase your resistance against harmful viruses. Keep yourself and your family healthy and protected with Organic.
Mahalagang paalala, ang Organic Acai Premium Blended Freeze-Dried Capsule ay hindi gamot at hindi dapat gamitin panggamot sa anumang uri ng sakit.
Previously on Wellness Wednesdays.
As we face the COVID-19, we are forced to distance ourselves from our loved ones. And
I wouldn't know the answer. Yes, hindi mo siya alam. Parang pag inisip mo.
No, sa province namin sa Japan.
Wellness Wednesdays with Organic. We care because you matter.
In support to DOH Vida Solution campaign.
Hi, good afternoon to everyone. Please like and share our Facebook live stream to your friends and families. Now, before we start, we have a game. Ito po, you can guess after the show. We will give you some gift pack, organic gift pack. If you can guess this, Grammy Award-winning singer, songwriter, producer, and she was tested positive, I think, back on March with COVID-19, and I really love her. I'm a big fan of her. At the same time, she donated around $1 million to coronavirus relief funds. Alam mo, her mother is a frontliner as well. Her mother is a nurse. That's why it's very dear to her. The hospitals, doon siya nag-donate. So if you can guess this person, after the show, we will give you an organic gift box, and hopefully that could help you on boosting your immune system. Well, now, let's talk about this coronavirus, a Frontliner's tale, my journey to COVID-19 recovery. As of August 17, by World Health Organization, there's around 21 million confirmed cases and 700,000 deaths. In the Philippines, as of August 18, DOH said that it's around 169,000 of confirmed cases and around 2,600 deaths. Now, in this pandemic, there's a lot of human life, human loss, and also emotions, physical, mental, and of course the financial burden that we carry on as we journey to this pandemic. But we will take a pause and discover the true heroism with our frontliners. So I'd like to introduce to you Mr. Manuel Carlos. He is a frontliner. He's working in a hospital, and he contracted a contracted a coronavirus disease. But his journey is amazing, and I'd like to have Mr. Manuel. Hi, sir.
Hello, Miss Cathy, and hello to our viewers. Have a pleasant afternoon po.
Salamat sa having to join us. And another guest person, of course, we will not talk about coronavirus without an expert. He's a fellow doctor. His specialty is in infectious disease, and he's a Philippine College of Physicians diploma, infectious disease fellow, internal medicine, adult medicine, and Philippine Society of Microbiology and Infectious Disease. I'd like to welcome Dr. Bryan Lim. Hi, Doc.
Hello, good afternoon. Thank you for inviting me.
Hi, good afternoon. So I'm with the two heroes, our modern heroes today, and I'm very, very proud to be able to have you and share your stories and also your expertise to our audience. Yeah. So, Mr. Carlos, can you give us your journey on this COVID-19, and what type of work you're doing in the hospital, and the signs and symptoms?
Yes, ma'am. I just want to introduce to you na I work in the ER as a ER nurse for almost 2 years din sa work ko. Yan. So, being in the ER, sobrang roller coaster, sobrang intense, na sobrang marami nangyayari, may mga ups and downs nangyayari. Then yan nga, this lately, so nangyari ng pandemic, sobrang daming nangyari na changes sa ER namin. So mas naging intense yung work namin. Ayun. Then this July 8, nag-swab ako. Then waiting for the result. Then the result came out about July 23. Then nalaman na na-diagnose ako with COVID. So, ayan. So, I admitted in the quarantine facility namin na hospital namin for 14 days. Then,
ano yung signs and symptoms na experience mo that you said, I think I have COVID?
Majority of nagkakaroon kasi ng COVID sa amin is asymptomatic. Yan. So sobrang grateful ako na yung hospital namin nagkakaroon ng regular swabbing sa mga employees namin. So every 14 days, sinuswab ko. So yun dito. On my case naman, sobrang thankful ako kasi sore throat lang yung naging symptoms ko. Nothing more, hindi ako nagkalagnat unlike sa mga co-nurses ko. Even though sa mga ibang colleagues ko sa ibang hospital. For me, it's just a sore throat. That's why I never had a fever. So, confident pa rin ako na I'm still healthy.
Okay. So, while you're in the hospital, ano yung ginagawa sa iyo? Anong treatment ang ginagawa sa iyo?
In the quarantine facility, before we go to our quarantine facility, may binigay sila medication. For me, some antibiotics because I have some sore throat, then multivitamins. Then aside from the multivitamins na binibigay nila sa akin, I take asay berry capsule po, organic. Then yun.
Okay. Yun. Inocument mo talaga, no?
Yes,
that's
po.
Good.
Actually, doon po ako nag-birthday kaya medyo memorable experience ko po.
Okay. So, Doc Lim, ito ba yung parang iba-iba yung experience nila per different age bracket, or why does he have a mild symptoms and others have very heavy symptoms?
That's a very good question, no? And I think the right answer there, to be honest, is that we don't know, because generally most of the patients who are young have mild symptoms. However, we do see patients in their 20s, in their 30s who have moderate, severe, or even critical cases. No, I even had a patient bodybuilder and then contracted COVID and was even intubated. No, I mean very healthy. Yet it only goes to show that there are several factors as well, or there are several factors regarding COVID that we still don't know. However, generally, those patients who are healthy recover faster or have less complications than those who have existing comorbidities. No? Kasi it's understandable if you have other diseases like the kidney problems, heart problems, diabetes, often ang bumibigay, ang worsen na aggravate itong mga comorbidities nila. No?
Okay. So ito bang pinisent dito, the possible presentation of COVID-19, ang dami nito, Doc. Para
Oo, totoo yun. Nakakaloka, no? Nakakaloka. O
nakaloka
kasi
to.
totoo yun. Dati kasi when the COVID was still new to us, we only thought na ano lang, fever, cough, sore throat, shortness of breath, or even lack of smell, no? However, now, because COVID has been here for a couple months already, COVID has, the virus has revealed itself to us. And the symptoms that is presented there, honestly, I have seen all of them in all my various patients since the start of the pandemic, no?
So
So
in one patient, pwede ito lahat ng symptoms? Or
yeah, naman kung lahat na meron ka na, 'di ba? May sakit ng ulo mo, na ano pa. But yeah, I mean, I have patients who come for ano lang ha, loss of appetite. And when you ask them, they would say na bakit wala kang ayaw mong kumain? Kasi wala na akong naaamoy. So, parang ganon. So, ang iba naman, dumarating sa amin, nagdadayarhiya, as in tae lang ng tae. So, akala natin, ano lang, amoebiasis or anong mga sakit sa tiyan, na impacho lang, ganon. Pero pag test namin, COVID pala. No? So, the key here is this, no? In this day and age na may pandemic tayo, mahalaga na meron na tayong kakilalang doktor dyan na pwede natin pagtanungan. Just in case may mga simptomas na tayo, may pwede tayong pagtatanungan. At mahalaga din kasi dito na kapag ikaw ay may comorbidity, meron kang mga sakit, may diabetes, may high blood, may stroke ka na dati, or overweight even, or chronic smoker, dapat mas aggressive po tayo kasi ito po yung mga sakit o comorbidity na mas worse ang prognosis, mas masama ang kanilang kalagayan later on, no? So bawat pasyente unique po talaga.
Oo. So yung kay Manuel Doc, sore throat lang. So you think nahawa niya from the patient? Diba?
Most likely yes. O ang ano to, napakaswerte ni Manuel, no? Malakas yan sa Diyos si Manuel, ano. I think of course he's a healthy young man, no? And then I think also he's eating well at the same time. Kahit pagod yan as a nurse, I'm sure he finds time to rest as well, no? Masaya sa buhay, gano'n, no?
Masaya sa love life.
May love life, gano'n. Ano nito is, mahirap sabihin kung sa pasyente ba talaga na kuha yung COVID, no? Yung virus. Kasi, pwede din kasi sa community, no? May isang study na nagpapakita na itong mga health workers na nagka-COVID, karamihan sa kanila nahawa hindi sa ospital, kundi sa kanilang mga komunidad. Bakit ganon? Kasi di ba sa ospital, alam ni Manuel yan, straight ang mga tao doon, nakamaska, naka-PPE ka, I mean, I'm very happy. I've been treating hundreds of COVID patients since March at praise the Lord, no? I'm swab negative and IgM, IgG negative pa. No? Yeah. Praise the Lord, no? Kasi siguro praning yung pagkatao ko, medyo praning ako no? So, I think, pero kung umuwi ka na, you let your guards down. So, you don't know that your family members or yung mga kasama mo sa bahay are not as careful as you. So, ako kasi, I live alone, no? Since the start of the pandemic, I left my home because I have elderly relatives there. I will never, ever go home to them because I don't want them to be infected by me. So, I think that's one of the reasons, no?
And that's a great sacrifice, Doc, that you've been taking, no? Actually, that's why you're called heroes ngayon. Kasi ngayon,
ayaw ko yung term na hero. Ayaw ko yung term na hero kasi hindi kami hero, kami ay alipin ng bayan. No? Kami ay mga pagod na alipin ng bayan. Kasi kami hero talaga. Kasi tungkulan namin itong health workers. I mean, na oath namin ito na mag-alaga ng may sakit. Trabaho namin ito. Period. No?
That's true. And you give your life, you give your time, everything, to help the community. Gagaya ni Manuel, no? Are you still working right now, Manuel? You're reporting to work.
Today is my first day na magre-report ko sa work namin. So, after sa president, makakapalit na rin sa work. Healthy.
That's good. That's good.
Of course, still with safety precaution pa rin po.
Yeah, hindi talaga magsusurrender. Kasi ang iba mag-awol, Doc. Di ba? But I understand. But since that's our oath, no, to take care. So, yeah. How does COVID-19 spread? I mean, alam na natin, but we want to reiterate this kasi yun na nga, sabi mo, Doc, always let our guards down, no? So,
Yeah,
Dapat
tama yan.
lagi.
Oo, tama yan. Ito kasing COVID, this is a respiratory pathogen. Ibig sabihin, sa lungs natin ito, lower sa lungs, at saka upper respiratory din, dito din sa ating bunganga, no? So, ito, nagsasalita ako. No? Kung what if, asymptomatic pala ako na may COVID. Every breath that I take, every time that I exhale, every time that I talk, I spread COVID, no? So, the thing with this is, droplet po ito. Ibig sabihin, tama po yung sinasabi natin na mga 1 to 2 meters, no? So medyo malayo-layo, mga 6 feet. Medyo heavy po kasi mabigat yan eh. So yung laway mo, pero yung mga taong showering, di ba may mga kaibigan tayo na napaka-excited magsalita, nagsha-shower, siguro mas malayo po yun, no? Mas malayo yun ang nararating na kanilang mga laway, no? But then the tendency of these droplets, really they do fall down, no? So mga 1 to 2 meters, mga 6 feet. However, I can warn you on this, no? In an enclosed space, like when you are riding a bus or when you're riding a car, or you are in a closed room, no, walang ibang tao, walang bintana, walang pintuan na kasara, salita ka ng salita, pwede po yan mag-travel na mas malayo. No? Sabi na nila may isang experiment na isang room na napakalaki ng room, tapos may nandito mga nagsasalitang mga tao, na-isolate pa nila ang COVID even beyond 6 feet. Bakit? Kasi umiikot kasi yan, umiikot. At ano na, for example, nagsasalita ako dito at meron akong aircon sa likod ko o may electric fan ako sa likod ko. Hala, yung mga bawat salita ko, hala, labas. Ano? May free ride.
Shower.
Yeah, so nasi-spread po talaga, no? At kung yung alam ni Manuel yan, bawal yung nebulization. Yung mga nag-nebulize, yung may mga steam na yan, pwede kasing sumakay ang virus doon na pwedeng kumalat, no? Ayan. So, yan, even more than 6 feet, pwede po siya talaga siyang mag-spread, no? So that's one, na it can really spread via our respiratory pathway. Second is really contact. Halimbawa, umubo ako, hinawakan ko tong cellphone, pinahiram ko sa kaibigan ko, hinawakan din niya, tapos ginanon yung ilong niya, wala na, pasok na po yung COVID. At saka yung COVID naman, ang entry point niya, mata, ilong, at bibig. No? Kaya napahalaga, ito yung poprotektahan natin. Hindi natin ito hahawakan. No? So knowing how COVID spreads is the key to devising strategies para hindi tayo mahawa ng COVID. No?
Yeah. Oo. So right now, okay. So how do we diagnose COVID? Kasi may mga diagnostic test, Doc, and which is more effective? Kasi I mean, you compare rapid and the swab test. How do you differentiate that?
It's a very good question, no? So allow me to run you through the life story of COVID, no? Halimbawa, no? Hindi ako nag-mask, hindi ako nag-face shield. Nag-inuman, nagtagay kami ng kaibigan ko. Di ba sa Bisaya, alam mo yun, ang tagay, isang baso lang yan eh. Pag inom mo, i-share mo yan sa kabila, hala, COVID na kayo lahat niyan, no? Nangyari sa atin yan sa Cebu, no? Na nagtagay kami. Na-expose ako ng COVID, day 1 yan, day 1. It would take around mga 3 to 5 days bago ako magkasimptomas. Okay? But you know what? This is the dangerous thing. 2 to 3 days before ako magkasimptomas, ay nakakahawa na ako. That's the peak of my infectiousness. You are 2 to 3 times more infectious 2 to 3 days before ka may simptomas. Imagine, wala ka pang ubo, nakakahawa ka na. Kaya ang COVID kumalat talaga. Kumpara mo ito sa SARS. Dati, no, ng SARS, day 1, day 2, may simptomas ka na, hindi ka na umuwi kasi pangit talaga ang simptomas. Itong MERS-CoV, ilang araw lang after kang mahawa, ano ka na, patay ka na kasi napakataas ng case fatality. Ito, hindi ka pa maglakad-lakad, mag-spread ka pa ng COVID.
Oo nga.
So, dangerous talaga. So, ayan, may simptomas ka na, di ba? Ano ka dito, na-expose ka. 5 days later, na may symptoms ka na. Pero dito, wala na, nagkakahawa-hawa ka na ng mga tao.
Ang dami mo nang nahawaan.
Dami mo nang nahawa, nag-party ka na, nag-disco ka na, kung ano-ano, ayan, no? So, itong first day na may simptomas ka, ito na yung simptomas mo dito, ano yan, it would last for how many days pa, no? Mga 10 days, And often, beyond the 10 days, hindi ka na nakakahawa. Pero depende din po yan sa sakit. Kasi yung mga matatanda, may mga immunocompromised condition, yung ma-weak ang immune system nila, mas matagal po yung virus sa katawan nila. So mas matagal din po silang nakakahawa. No? So hindi po, ito mga healthy, ito si Manuel, after 10 days, okay na yan, hindi ko na yan, balik ka na trabaho, walang problema na yan, kiklear ko na siya. Pero kung itong pasyente, maraming ibang sakit, yan. Now, itong PCR at antibody testing, kapag diagnosis talaga, PCR po talaga tayo. No? Kasi ang PCR, nagdi-detect niya yung COVID on the day of symptoms at saka yung may mga symptoms ka pa. Okay.
Pero what PCR, Doc? PCR is the swab.
Yung sineswab ka, yung sa ilong,
Okay.
sa ilong at saka sa bibig, masakit yun, no? Na-try ko na yun, para ka na yung kaluluwa mo, sinusundot na, no? Parang wala ka na pulangot paglagal na. Pero ito yung dapat isipin ng mga tao, yun pong PCR, hindi po siya 100%. Wala pong 100% sa mundo, no? Kahit sa pag-ibig, walang 100%, no? Kahit nalalabas ako ng bahay, pwede pa rin kang may mangyari sa'yo, di ba? Walang 100, wala talagang sure. And nasasabi na nila, ang accuracy lang yan, nasa 67%, 67 to 80%. So, halimbawa, huwag tayo magtaka. May pasyente na negative sa PCR, negative sa swab test. Pero sabi ng doktor, ng infectious disease specialist, COVID yan, maniwala po tayo. Bakit? Kasi hindi naman natin ina-diagnose ang swab eh. Hindi naman ilong lang yung tinitingnan ng doktor eh. Pati yung baga mo, meron po yung mga tinatawag nating ground glass opacity sa CT scan, meron kami nakikita. Meron din po mga lab test sa dugo na nakikita namin na tumataas kapag COVID. So, ano po yan? PCR, tama, yun po yung swab test. Pero, importante din po yung clinical judgment ng doktor. Kasi yun nga, hindi po 100% ang accuracy ng test.
Now, that explains why ang iba, negative sila, but like, for example, the cause of death is COVID.
Yes. Nagtataka ang mga tao niya na ano ba to, mga doktor na to, gusto lang tong kumita. Hindi eh, di ba? Meron talaga na COVID presentation, no? That needs to be understood.
Yeah. Thank you for clearing that up. Kasi ako din nagtaka. I mean, I thought swab test is like 90% or 99%. Pero other, like, yun na nga, x-ray, other symptoms. Okay.
Scan, laboratory test, yeah.
What about the rapid test, Doc? This is very popular.
So the rapid test kasi, nadidetect lang niya yung nadidetect lang niya yung antibodies on the 7th to 8th day of symptoms. Diba sabi natin, expose ka after 5 days, tsaka ka pa magsisymptoms, tapos count ka na ng ilang araw. On the 7th day pa yan nadidetect.
Ang tagal.
So halimbawa, you will rely on antibody testing to diagnose. That's wrong. Wrong talaga. Kasi kung wala pang symptoms, mag-antibody testing ka, ay wala yan. Hindi ka na mag-isolate kahit na-expose ka kasi negative. Mali. Kasi during that time, wala pa talagang antibodies. Okay? And during that time, dito, sasabi natin 7 to 8 days, what if tinest mo siya on the 3rd day, wala pang antibodies? Tapos sabihin mo, ay, wala yan, alis ka na, lakad ka na ng lakad. Kaya po, itong antibody testing, dapat doktor po talaga ang mag-prescribe niyan. Kasi ang pag-analyze niyan, hindi po siya ganun kadali na positive, negative. Hindi gaya ng pregnancy test, di ba? Basta yan na ako. Ito hindi kasi i-correlate pa namin yan sa clinical data. Oo. So, as a screening, hindi po talaga siya recommended, no? But if you want to monitor, like surveillance, you want to know kung sino na ang na-COVID in the past, pwede yan. Pero yung talagang gusto mong i-diagnose na COVID ba to o hindi po talaga siya magandang test.
Okay, so the only recommended is the swab test.
The swab and clinical judgment. Dapat hindi siya makakalimutan, no? Hindi mo pwede na, I feel ko lang magpa-test and that's it. No, you talk to your doctor. Okay? Sometimes, nagpa-swab yung kaibigan ko, negative. No. Na-expose ka sa nanay mo na may COVID, isolate ka muna, I will repeat it after how many days. Ganun ako. Depende po yan kung saan ka sa sequence ng disease. Di po ba?
Very good point, Doc. Talagang very clear. Kasi,
Thank you.
yun na nga, if you think na nag-swab test ka, negative, and then you're fine, you're free to go. Enjoy.
Dangerous po yun. Dangerous yun. Dangerous. So, what is our moral implication? Kasi we will proceed to prevention. What is a moral obligation? If you think you have been exposed, do not go out, isolate yourself. Diba? Halimbawa, nangyari na sa akin yon. Nag-duty ako, pumunta ako sa pasyente, nalaglag ang aking face shield. Diyos ko Lord, nalaglag. Alam mo, ginawa ko, tumakbo ako palabas. Hindi ako pumasok sa trabaho ng 5 araw. Oo, kasi what if may lumusot? What if may lumusot? Diba? So it's my moral obligation, baka maging super spreader pa ako. And then nagpa-swab ako kung negative, di ba? So, mahalaga po yun. Let's be honest. Let's be honest. Huwag tayong tago ng tago. Hindi po yan. Because we can kill others. I keep on saying this. Those who don't wear masks and face shields are potential murderers. Kasi what if nakahawa ka ng matanda at namatay dahil sa'yo? No? So, kailangan seryoso po talaga siya. Hindi po talaga siya joke-joke lang. No? Oo.
Not take it lightly. Kasi nga, Doc, hindi na makita. So, parang sa kanila okay lang, no? Yeah, very dangerous. Okay, so let's talk about the prevention. So, if we can go for the next slide. There. So, Doc, safest.
Yeah, tama. Pero ito, you're safest at home, this might not be true. What if there are other people who go out and they do not follow the social distancing, hand washing, face mask, face shield, then your home becomes a hot spot, no? I tell you, I even have patients na 8 of them have COVID. It started with their grandson who keeps on going out because he buys groceries, etc. Came home and infected everyone, no? And it's sad to note that 2 of the grandparents actually pass away, no, because of COVID, no. So your home may not be safest. So I urge this, no. It's also very important that when you're at home, make sure that you all follow na pagdating niyo sa bahay, maligo talaga, no. Ako, basa yung buhok ko, di ba? Kasi pumasok ako nagaling akong rounds So ginawa ko noon, each time I go home, meron akong special area where I take off my clothes, nakasoak na yan sa bleach solution kasi ayaw ko naman yung mga naglalaban ng aking gamit mahawa, di ba? So naka-bleach ko yan. Mahawa naman tayo kasi kababayan natin yan. Diretso ako ligo. Hindi ako ever makahawak ng kahit ano. Diretso ako ligo. Okay? Bago ako papasok at uupo. Kahit ito nga interview mo, naligo pa ako kaya nga hindi ako nakasagot kanina kasi hawak ako ng laptop, dapat malinis ako. So clean area po ito. Ayan. So you have to afford that you can be safest at your home. You need to be sure that your home is safe. Okay?
Yeah.
So but I do agree. Indoors pa rin, but what if your indoor is not clean? Now that's a problem.
Yeah.
No?
So, may proper protocol pa din. Hindi yung let your guard down kasi nasa bahay
ako. Honestly, when I visit my mom, kasi she lives with my other elderly uncles and aunties, alam mo where we eat? We eat outside. Ang layo namin, as in, ang layo namin, more than 6 feet, siguro 10 feet apart kami. I haven't hugged my mom, I haven't hugged her for 6 months already. I will not dare.
Yeah.
I will not dare.
Self-sacrifice.
Ang mangyari nito, our shoes nasa labas lahat, no? Nasa gate, para sa loob, iba ang tsinelas. No, kasi tayo dito sa Pilipinas, mahilig tayong mag-split sa kalsada di ba? Tapos what if may COVID yun, tapos naapakan mo sa bahay mo at may batang nagkukrol-krol dyan, hawakan yung, kasi kinain niya, wala na. COVID na. Ay, nako, di ba? So change your shoes. Ako, lahat ng sapatos ko nasa labas. May iba ang aking shoe wear sa loob. Di ba?
Yun, no? It's really a good point na you remind us kasi talagang those simple things na hindi natin naisip. Right?
Tapos ang style ko din kapag yung mga nagluluto, wag kayong wag yung tipong tikim-tikim tapos luto, no. Dapat kung nagtikim ka, muna kasi may saliva, what if may COVID ka, asymptomatic, mahalo na. Yung sausawan, Huwag kayong mag-share ng sausawan. Dapat sarili kayong sausawan. Di ba?
Oh,
So
yeah.
basically, kung may mga matatanda kayo, kung pwede, huwag kayong sabay-sabay kumain kasi walang mask yan. Pwedeng una muna sila, tapos next na kayo or something, or mas mabuti nga sa labas kayo kumain para may social distancing at may ventilation, no? Mas wide ang area. No?
Yeah. I think, Doc, sa statistics, yung sa office, yun ang spread nila during mealtime, during lunchtime.
Yes. Oh, yes.
Your mask.
Even in the hospitals, that's when we trace itong mga nagkaka-COVID, nahawa sila sa lunch. Kasi di ba masaya kasing after ng work mo, masaya yun kahit kami, after ng duty, ang sarap kumain. Tapos, ano yung ulam mo dyan? Pahingi, ang sarap mo. Di ba? Time natin yun to be together but my goodness. You know what? Be very careful because that can be the source of your COVID. I had a patient who went to his dialysis, bawal kumain, tapos kumain siya doon, na COVID siya, namatay unfortunately. Kumain lang siya kasi nagutom siya kahit bawal, tago-patago siya. It's very unfortunate but it's true kasi when we eat kasi nakamask tayo, di ba? Ang dapat, wala ka na protection, you have zero protection, zero.
Tinanggal mo na lahat yung protection.
Zero talaga.
Totoo. Yeah. So,
kaya bago ako mag-rounds, kain ako ng marami sa umaga. Never ako kakain sa ospital. Never. Kahit gaano kasarap yan, hindi ako kakain. Tapos kakain ako sa gabi na. So para ako nag-intermittent fasting somewhat. No eating and drinking ako. At so, kung sobrang gutom na ako, lalabas ako. Iinom ako sa labas. Sa parking lot. Doon ako iinom. Tapos babalik na naman ako. Kasi you have to have that discipline Okay? Sige. Yung mask natin, nandiyan, Kanina yung mask. Na-mention yung mask. Your mask is only good kung maayos yung paggamit. No?
Yes. Yan. Okay. Sige, Doc.
Alam na natin yan, na itong colored, ito yung dapat nasa labas. Itong puti, ito yung nasa loob. Ang key nito, bawal mo ito hahawakan. Never mo ito hahawakan kasi ito yung expose So dapat consider it as dirty. So halimbawa, pag ganyan mo, di ba? Ilalak mo yan sa ilong.
Yeah.
Dito, you open this up para cover dito. Dapat sealed dito, dapat sealed. Minsan may nakikita ako, ginaganyan nila.
Yan,
Malito yan kasi meron ng space
opening
dito. So malito yan. So kung loose ito, dapat itatay mo na lang dito sa likod. Di ba? Kung meron yan, i-clip mo na lang para sealed. At ibang tao, after chika-chika, gaganyan. Mali! Bakit? Pag ganyan mo, kung may COVID dito sa leeg, pag ganyan mo, ang COVID nalagay na sa loob. Ilalagay mo dyan sa mukha mo, COVID ka na.
Oo
At
nga.
ang iba naman, okay na to. Ilalagay nila sa wallet nila. Mali! Di ba dirty ito? Hinawakan mo, nilagay mo sa bulsa mo, may mga keys ka doon, wala na. Your entire pants is contaminated. So if ever you're gonna remove this, take this out and you can hang it. Hang it. No? Ako sa kotse, meron akong hanger na may clip at nilalagay ko yung mga mask ko doon.
Okay.
Okay?
Doc,
things matter,
Doc, what about yung cloth mask? How
yes, no. I mean, of course, cloth masks will be okay for the general public. No,
Okay.
but of course, we have to reserve our surgical mask and N95 for the health workers, no? But if ever itong mga matatanda, surgical mask tayo for the elderly.
Yeah.
Tsaka yung may mga sakit, elderly, may mga diabetes, hypertension, surgical mask tayo para kay kawawa itong mga lolo't lola natin. Kasi to be honest with you, surgical mask is still best. It's still better than a cloth mask. But cloth mask is better than nothing. Yeah?
That's true. And may isa pa, Doc, yung yung ventilator sa mask.
Oh yes, I have that. It's actually cheaper, no? Kasi the ventilator, parang yung N95 at very sealed. And they can last for 6 months, no? But make sure when you use the ventilator or the respirator, make sure that you know how to clean it. Kasi kung hindi ka din marunong maglinis, wala din kwenta, no? So So before you buy something, you investigate. How do you check? How do you clean? Para sure ka. Diba?
Yeah. But there's a study, Doc, na yung binabawal yon kasi it will allow COVID. If you're COVID, so yung hangin,
you're
pwedeng
right.
lalabas.
If, when you buy yung ventilators, please buy na yung may filter sa exhaust. Kasi ventilator kasi, yung respirator, may input yun, may may filter yan, tapos may exhaust, may valve palabas. So, minsan, yung mga respirator, wala kasi silang filter sa labas.
Yan.
So, ang ginagawa niyan, merong bumibenta na meron kang nabibili na parang attachment para malabas na siya. Para naman yung responsible to other people na malinis ka dapat yung mga paglabas mo, malinis din. No? Oo.
Okay, that's very clear.
But I need to warn the people, kasi of course there's a lot of online shopping going on. Please check the authenticity of these respirators and masks because there are already some na na talaga yung joke-joke lang. No? Nakakatakot po yun kasi feeling mo kayo na pero hindi pala. Parang ganon, no? Na marami namamatay sa maling akala, sabi nila, no? So, I would recommend, kung gusto niyo na talaga ganyan, isa po may mga pasyente ako, no? They call me up na where to, kung legit ba ito, so they send me the, so you can call your favorite healthcare worker at mapabili ka, especially for the elderly, no? Itong mga matatanda talaga, protektahan natin. Kasi alam mo, na ako personally kami mga health workers, traumatizing po talaga kung namamatayan kami ng matatanda. Napakasakit sa dibdib namin. Alam mo yung, it will be a very lonely Christmas for so many families, no? So,
that's true.
Let us take care of our elderly. Let's do everything to take care of them, no?
Yeah. Doc, there's a question. Surgical mask, pwede din bang labhan para magamit ulit?
No, you cannot, no? Because a surgical mask is a filter na if babasain mo siya, para siyang filter na nagko-contract, no? Para siyang, imagine meron kang filter na mesh, para siyang mesh. Kung basain mo yan, nasisira siya. So, hindi talaga siya, it was not designed to be cleansed. Pero, I don't know, there are some masks out there na pwedeng malabhan. Depende po yan. So, please consult a health worker to assess what mask you want to buy. Okay?
Okay. Yeah. And then, okay ba pong mag-sanitize ng Zonrox bleach?
Okay. So, for the mask, you should not wear Zonrox. You should not sanitize. As I've said, the surgical mask, you have to throw it away afterwards. But for the clothes, yes, no? What I do, you follow the dilution that's recommended. You soak your clothes for 30 minutes, no? Yeah. Nakakatawa, hindi ko kasi alam na ang bleach pala may decolor at hindi. So, ang dami ko mga acid wash na tuloy na damit, no? So nakakatawa, obviously hindi naglalaba, no? So, yes, no? Bleach is the best. Mga walls ko, nililinis ko po yan. Even sa hospital po, yung room, bago yan, pag alis ng pasyente, binibleach po yung mga floor at saka mga... But a word of caution, ito kasi may mga businesses, ito po yung mga map natin, yung minamap, di ba ilang araw na po yung map na ganun, yun pa rin yung ginagamit. Hindi po tama yun, okay? Parang mas matumi pa yung tubig sa map kaysa sa imamap nilang floor. Mali po yun, ha? So, you need to... Nakakatawa yan, parang wag mo nalang imap kuya, parang may COVID pa yung map mo. So, turuan nyo yung janitor na ito kasi yung bleach, may lifespan po yan, nag-evaporate po kasi yan. Dapat freshly prepared. Meron naman po yung instruction sa likod No, kung chlorine gagamitin nyo, meron po yung, basahin po yung instructions. Kung sabi doon, good for 4 hours, maniwala po tayo doon. Di ba? Oo, sige.
Okay, so here's another question from Virgilin Aboniha. Doc Lim, kailangan po ba laging suot ng face mask kahit nasa bahay?
Ako, personally, yes. Kung hindi ka sure na yung mga kasama mo nasaan nanggaling at hindi ka sure kung safe sila sa pinupuntahan nila, recommended po siya. Style po yan. Kasi ang ginawa ng isang kaibigan ko, nag-zoning siya ng bahay. Ganito po yun. Yung mga matatanda, may plastic cover, hinati nila yung living room. Ang galing-galing nga Nasa gitna yung television at may plastic dito at may plastic sa gitna. So, nandito sila lolo at lola at yung mga bagets nandito.
Oo.
So nag-gets niyo yun? So yung ano nyo, yung living room nyo, nanonood pa rin ng TV, if kayo. Sa baga, di ba? So may
Yeah.
ganun po tayo. Oo, pero ako personally, kung meron kayong mga elderly sa bahay at may sakit, mag-mask po tayo, lalo na kung tayo po yung lumalabas. Kasi di po kasi talaga natin alam kung meron pa tayong COVID o wala. Kasi what if asymptomatic carrier pa tayo, di ba?
Yeah. Okay. So, ang ganda ng topic natin ngayon, Doc. Ang dami namin natutunan sa inyo. So, we still have a lot of things to cover, no? We'll go for the next slide. Next slide, Ja.
Yeah.
So, yan. Plan ahead and limit your trip.
Tama yan. No? Itong mga meeting, kung may mga meeting na pwedeng email na lang, Diyos ko Lord, email nyo na lang, bakit mag-meeting pa tayo? Di ba? Kung yung meeting pwedeng i-zoom, edi mag-zoom na lang or something, di ba? So, ang style niya, kapag agree, limit nyo kung may mga meeting talaga kayo na face-to-face, dapat ano kayo, dapat tawag mo dyan, yung agenda nyo dapat maayos para mabilis matapos. At yung shopping, wag na. Dapat alam niyo na yung bibilhin nyo. Di ba?
Yeah. So dapat essential trip lang, groceries. Pero ano nga, Doc, no? If pwede i-deliver na lang.
Oo, pero itong mga delivery, delikado din kung hindi maayos, ha? Dapat kung may delivery kayo, marunong kayong maglinis. So ang style namin dyan, itong mga palasada-lasada natin paminsan, hindi ko binubuksan yan for 2 to 3 days. Hinayaan ko muna na mawala na yung COVID. Di ba? Kasi what if yung may gadget ka, tapos hindi mo na pwedeng basain yan ng bleach, di ba? So, I don't open it for 2 to 3 days kasi hayaan ko munang mamatay yung COVID dyan. So, yun na mga delivery nyo, dapat meron kayong, hatiin nyo yung may clean side, may dirty side, may clean side. Bawat nyo dito, palagay, dapat ina-alcohol nyo o hinugasan. Yung pagkain, soak the vegetables in water for 5 to 10 minutes. Tubig lang. No? I-soak nyo. Tsaka yung may mga pa-chips kayo niya, pa-silyar, alcoholan nyo yung sa top. Kasi dyan kayo dyan kayo hahawak eh. Yeah? Oo, parang ganun.
Good. Okay, so another prevention would be having a healthy lifestyle, di ba? So yung na-mention mo doon, this is really the parang dapat natin gagawin din, no?
Dapat talaga. Oo, kasi ito kasi infection, gera po yan eh. No, kami mga infectious disease, ang tawag namin yung mga war freak, no? Pinapatay na, sabi nga nila, explain your career in one sentence ko na I kill little things, no? Truly, I kill bacteria, virus, worms and everything, no? But it's ganun kasi yun eh. Ang katawan natin, yun yung parang baril. Ay yung mga antibiotic, antiviral, yung mga gamot sa COVID, yan yung bala. Okay? Kahit ang ganda, ang dami mong bala, pero yung baril mo, weak na, hindi ka makakashoot. Parang ganun po siya kasimple, intindihin. So dapat malakas ka. Tama po yung exercising. Pero yung exercise, hindi ako nagre-recommend na mag-exercise ng maraming tao, ha? Hindi yan recommended kasi pwede kang ma-COVID dyan. Kasi ba nag-exercise ka, grabe ka, yung paghinga mo mabilis. So kung may mga COVID dyan, in-inhale mo na lahat ng COVID sa katawan mo. So mabuting, kung jogging, ikaw lang mag-isa. Ikaw lang mag-isa. Kung marami ng tao, jogging ka sa ibang area, dapat ganun. Smoking is a no-no. Proven already. Those who smoke or even yung mga nakakaamoy ng second-hand smoke, 2 to 3 times higher sila ang chance nila na magka-COVID. Okay? Kasi the thing with smoking, it makes your lungs attractive to COVID. Kasi yung mga smokers o yung nakaka-inhale ng smoke, yung architecture ng kanilang lungs nagbabago. Mas nagiging sticky sila, dumidikit yung COVID doon. And I tell you, yung mga pasyente ko na in their 30s na namatay, all of them are smokers.
Wow.
Okay? So, limit your alcohol intake. Totoo yun. Of course, stress tayo, kailangan konting, ako I understand that, pero limit lang. Kung may wine ka, 1 glass of wine is enough. Beer, 1 bottle of beer is enough. Pero bottle na maliit ha, hindi yung litro ha, na Red Horse, hindi naman po gano'n ha. May pilosopo tayong mga tao na 1 bottle lang naman, Dok, 1 litro pala, mali po yun ha. Yung maliit na bottle will be fine ha. Adequate rest, yan. Walang tatalo sa pagpahinga. Bakit? Once you're resting, your immune system, yung baril mo, nililinis po yan. para ready ka mag-attack the next day. Ayan. Kung kulang ka sa tulog, ay Diyos ko, kawawa. Siguro itong mga nurses namin, hawa yaan si Manuel kasi masyadong masipag, no? Pagod yaan, ako din, pagod din. So, ganun po. And good nutrition. Ako ngayon, ano na ako meron na akong yung diet na, yung diet in a box na vegetables, may mga whatever, na hindi ko naintindihan kung ano yun. Wala akong choice kasi I need to make myself healthy. Di po ba? Kasi gawin mo ng katawan mo
Yeah, that's true. So ikaw din, Manuel, ganun din ka. Kasi nasa hospital ka, you have to make sure you have a healthy lifestyle. No?
Yes, ma'am. Aside from the previous healthy lifestyle, as much as possible we avoid stressors. We maintain a positive outlook in life. So, syempre, pag stress din, para nakakababa din po ng immune system. So, as much as possible, we think positive. Every moment.
Tama yan.
Oo. Kasi ang nasa ER, parang sabi ng mga doc, parang war zone, no? Everybody's so busy, everybody's so hectic. Parang, di ba? So you have to have a clear set of mind and a positive outlook, no?
Yeah.
Yeah, so there, and then, of course, you boost your immune system kasi kailangan natin yan. Yun ang nga sabi mo, Doc, baril ang katawan natin. Yung how to fight, we have to have a good immune system, no? And then, another thing, can you go for next slide? Yan. Okay. We are in the end of our discussion, Doc. Then we have to answer this, fact or myth.
Okay.
People do not wear masks while exercising.
Okay. I am an advocate of exercising in your home. Okay? Because the best place to exercise is still in your home. And if you are in your home, it's okay not to wear mask when you're exercising so you can breathe properly, di ba? Okay. But I think you are exercising and there are so many people out there. Invest in a good respirator. That I would say, wherein you can breathe more freely. No? Yeah. So, ano siya? It's both, fact or myth. No? It's both. Huh?
Okay. Thermal scanner cannot detect COVID-19.
That's true. Kasi itong thermal scanner natin, Diyos ko, what if na paracetamol pala yung tao? Di ba? Maraming, Diyos ko, pilosopo na, sasakay ako ng airplane, uminom ako ng 3 paracetamol, Diyos ko po, no? So, mali po yan. So, even thermal scanners also differ in terms of their accuracy. So, it will not detect COVID. Okay? And take note. Di ba, we mentioned that there are so many possible manifestations of COVID. Fever is just one of the many. Di ba?
So, pwedeng wala kang fever, but meron kang ibang So, you cannot rely on the temperature checking.
Yes.
Okay, yeah. So there are currently no drugs licensed for the treatment or prevention of COVID. What do you think?
That's true. But we also have the ongoing researches and ongoing clinical trials. And there are some that's very promising, no? So the thing with COVID is treating the patient. Now, meron kasing different stages ang COVID. I will not explain further here. But when you give these drugs and these treatment regimens at certain times, you can optimize their recovery. And I have had patients already, the oldest patient ko, 101 years old, nabuhay po, So, it's really a matter of catching them early and giving the treatments early, no? Okay.
There. Okay, so exposing yourself to sun or temperature higher than 25 degrees Celsius does protect you from COVID.
Diyos ko po, ang init-init ng Pilipinas, no? So, kung ang sunlight na palang solusyon niya, dapat immune na tayo lahat dito, Pero hindi po totoo yan, hindi po totoo. Kasi, Okay, next.
So is it true that we can be reinfected by the virus again?
Yes. Not all people can mount an immune response to COVID, no? Lalo na po yung mga matadanda, may immunocompromise, yung immune system nila mahina, pwede po silang mahawa muli ng virus. So huwag tayong kumpiyansa na, ay, happy na ako, tapos na ako. Hindi po yan ganun. Pwede po siyang bumalik at mahawa muli. Okay.
Okay. Does it live in your food like fresh salads? Yung sinabi mo na, no?
Yeah, kung hiyawakan niya, hindi mo yung hinugasan ng maayos, pwede po. I need to just emphasize this. For example, if you have patients at home that are cancer patients, yung mga immunocompromised, yung may mga lupus, Kung kakain man kayo ng mga, avoid muna tayo ng mga hilaw na pagkain. Kung kakain man tayo ng apple, ipil natin.
Okay.
No? Kasi hindi natin alam kung saan gumiling-guling saan nag-roll-roll yung apple na yan, di ba? So, po yung mga prutas na nababalatan, like saging, mangga, yung nababalatan mo talaga, melon, ganun. And be careful also, yung pag-chop ng melon, dapat malinis po yung knife natin. Okay? Yung mga shake-shake, mabuti na dapat malinis po yung ice kasi minsan yung ice hindi malinis. So dapat we need to be extra careful, especially for the elderly and those who are sick.
Okay. So is COVID-19 airborne?
Okay, COVID-19 is aerosols and droplets. But if you are in an enclosed space na walang ventilation, pwede po siya magstay sa hangin for quite a while. Bottom line.
There.
Oo, sige. Pero hindi siya airborne in a sense na iba po kasi ang definition ng airborne eh. Airborne in terms of sa amin, in terms of size po kasi yan ng particles eh. So yun hindi po siya. Pero pwede po talaga siya sa hangin, no? Oo.
Yeah.
Does it infect animals? We don't know, but it originated from animals. So there is a reason to believe that it can. Okay? So ang style ko niyan, when I touch my dog, I have a dog eh. I ligo muna ako before I even touch my dog. No? Oo.
Yeah. Okay. So is rapid test reliable? I think we answered that.
Depending on how you use it. Depending on how you use it. Okay?
Okay. So do we have any other questions? Okay. So I think ang ganda ng topic natin ngayon, Doc. No? I think with fact and myth, you really answered it. And si Doc, may comment si Arvin, daming learnings. Ako din, ang dami kong learnings. I mean, speaking from, the most experienced people, no? Like you Doc Lim and si Manuel, na nasa frontliners talaga. I mean, iba yung mabasa natin at iba yung na-experience, no? So, Doc, thank you very much. And I want you to have the last, yung mga words, Doc, words of wisdom regarding this COVID, the last words for us.
Okay, so I think I keep on saying this, no, but the solution to this pandemic is really love, no? Love for yourself, love for your family, and love for each other. So if you love yourself, you will wear a mask and face shield, you will do hand washing, you will practice social distancing because you don't want yourself to be infected. When you love your family, you also would wear mask, face shield, hand washing. May palaging katabi ko po ito, best friend ko po itong alcohol, best friend ko po ito, no? Palagi kong dala-dala ito, paborito ko ito. And then even a social distancing because you love your family. And kailangan dapat talaga we expand that love, no? Love for each other. Do unto others what you want them do unto you. So it's so basic, no? It's so basic. But I always see this as it is a lesson for humanity. That we are one species, one humanity. And the only way to solve this is for us to take care of each other.
There. Yan. Totoo, Doc. Thank you very much. Thank you. And I hope I'll invite you next time, Doc. Thank you, Doc.
Okay.
And Manuel, being a COVID-19 survivor, ano yung ano mo sa the people who are currently experiencing that disease? Ano yung mapapayo mo?
For those, thank you for the opportunity na gusto ko lang to encourage na yung everyone, not just the co-workers ko na infect, but all those patients. Kasi this battle of COVID-19 is not just physical, but it's more on emotion then, of course.
Yeah.
Most of people are getting lonely, then depression strike. So so we should be more should be more love. Sabi nga ni Dr. we should be more love, and we should be we should always take care of them, and we provide, and we should be this is not the time to be selfish. No, you should be sensitive to others' feelings. Then, of course, maintain your positive outlook in life, and of course always pray. Number 1 po.
Yeah, actually, the support that the people, the community should give to each other, and especially you guys now who are frontliners. I mean, for the people. They have to take care of themselves so that kayo din na frontliners, hindi kayo masistress, no? Taking care of so many patients at one time. So we have a winner for our trivia kanina. Ang answer po I see Pink. The singer is Pink, yung pangalan. Yeah. Si Zinaida Rotas, so we will mail you your prize. Zinaida Rotas, Concepcion Tria, Colleen Balasbas, Me Cruz Fajardo, and Virgilin Abinuha. So thank you very much, and hope with these learnings we will apply it to our daily lives so that all of us will be free from COVID and we can curb the rise of this pandemic. Thank you and God bless po sa inyong lahat.
Wellness Wednesdays with Organic. We care because you matter.